I'll come here first. My name is Jennifer Pressimone. For those of you that are new to me, for those of you listening in on the recording, thank you. I first want to thank you, Robin, for inviting me. I know that you are a huge advocate in education, always trying to bring new information and keeping all of us aromatherapists together and connected. And so I just want to say thank you so much for the opportunity to share. It's a very profound topic, but this is some new material that I wanted to present just to you guys. So first off, thank you for all that you do. I am a clinical aromatherapy and herbal educator. I have been a practitioner for over 20 years. I've authored several books. I'm a product formulator. I've formulated hundreds, probably thousands of different products for different companies, including my own. I am a director and vice president for the National Association of Holistic Aromatherapy. And my favorite jobs, I am a pet mom, an auntie, and a great auntie. And, as much as we define ourselves by our work role, our careers, we also have to remember that we're human and that we have a personal life. We're allowed to have a personal life. I don't feel like I've had much of a personal life lately, but I'm working on that. I think we're always a work in progress, a work in process. And today's presentation is really going to tap into that. So we will go ahead and get started. And I'm going to talk about aromatherapy, clinical aromatherapy, professional aromatherapy, holistic aromatherapy for neurocognition and psyche balance. And that can be an intimidating topic, but basically we're going to talk about why do we think, feel, and act and behave the way that we do, and what can we do to foster more of healthy responses versus unhealthy reactions. When you learn about yourself and you understand yourself, then you can grow forward, whether that's personally and or professionally. So quick disclaimer, the information I'm sharing with you has not been evaluated by the FDA. It's for educational purposes only and not intended to treat, diagnose, cure, or prescribe. So I first wanted to open up with my personal scent journey for my psyche growth. So for me, my whole life, I've pretty much been the peacemaker in my family. I'm a caretaker. I take care of everybody. I'm always giving, 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 which it was no surprise that the career jobs that I took over were more customer service jobs. Every role that I had customer service pretty much at the top of the list. I did get my bachelor degree in psychology, and throughout my lifetime, I have endured, just as you have, many emotional traumas. But what we do with those traumas is what can help us. Our traumas don't define us, but they can help us. And so we turn those into triumphs. And so that was a little bit of a background. But then from there, I really was able to merge who I am. I was able to honor, you know what? I am a caretaker. I'm not going to apologize for that. I do need to set boundaries, but I need to own who I am and be comfortable with that and not be embarrassed or not hide it. I need to own it. And so if I take who I am at my essence and I merge that with what I feel called to do, which is help people, that's our purpose. That's our calling. I love empowering people. I have been fortunate to have had some amazing people, from teachers and mentors and bosses and friends, that really have inspired me and empowered me. And I want to be that guiding light for somebody else. And so I lead forward. And that's why I'm passionate about education and sharing my experiences and what I've learned, because why should you have to reinvent the wheel? Or maybe you're stuck in a situation and don't know how to handle it. Let me share what I did. Maybe it'll help you. Maybe you can take one thing away from that. And this is how we pay it forward to our next generations for, how we handle health going forward, whether you are stay-at-home mom or you are a practitioner. What can we do with this? So for me, the theme behind my story, my psyche growth story, is a theme of giving and helping. So, what I want you to do as we move forward, the starting point right now, you are now in neurocognitive and psyche balance mode. I want you to think about, what is your theme? Who are you at your core? And really connect with that, because it's going to help you understand why you act the way you do and why you react the way that you do. And then you can define your journey. Where's your journey going to go? Where are you in your journey? Where do you want it to go? Oftentimes we run, but we forget to create a plan and run in a direction, intentional direction. We just run. And so I want you to start by applying this, really connecting with yourself and being in self mode as we go forward. So the objectives that I would like to give you is to discuss the role of scent and how it interplays with neurocognitive functions and the impact that will have on your mindset, your motivation, your behaviors, your whole psyche, because this is where true emotional cleansing and healing happens. How to use clinical aromatherapy strategies to influence mental health and your psyche balance. We're going to talk about the gut-brain connection, those functions and processes involved. How does it affect your psyche, and what can you do to nourish that and nurture and strengthen that? And then we'll talk about how you can interpret scent preferences. When you like a scent or don't like a scent, what does that mean? And how you can create a balanced custom blend, because when you get a blend right, when you put the right team of oils together, you will get amazing results, exactly what you need to balance your psyche. Because not only do we want to balance our imbalances, we want to keep whatever's in balance, we want to keep it that way, we want to keep it strong. So let's start by exploring the psyche. Right, so the psyche means this is your collective being, all of you, all of the essence of your being. And Greeks define this to be mind, soul, and spirit that drive your behavior. All of who you are gives rise to why you act and behave and respond the way that you do. And if we go back and we look at Carl Jung, he was a psychiatrist in the early 1900s. He was in the Freudian era. They had some differing opinions, but I do like how he has defined the psyche, and that is the interaction between our conscious, our ego, how we drive, and our unconscious, which has two different layers to it, or two different systems of how it processes itself. We have a personal unconscious, which is repressed memories. When you don't deal with something, something happens and you push it in and you bury it and you hide it, it gets repressed. This is where this is happening. So you have that that's going on, but you also have the layer of collective unconscious, which is your archetype or ancestral memories. Every ounce of your being, generationally deep. And we know, we used to have science that said, oh, your genes go back 7 generations. Well, now it goes back even further than that. And so we have everything from, our family before us that has made us who we are. You have that to deal with too. So you have who you are, you have what you're repressing, and then you have all of this other stuff from your ancestral line. So give yourself a little bit of grace, give yourself the space and the grace to manage and to love yourself, good, bad, and ugly, and to have the ability to say, okay, a compassionate heart to say, all right, this is what's going on. I'm going to work through it. Because from here, you develop your own persona. You take all of this and then you create who you are. And oftentimes it's a conditioned appearance. It's a facade of what you think people want to see, right? That's the whole thing of social media. We tell everybody all the good. Rarely do we share the bad. Some people share a lot of bad, but we share all the pretty. And we tell people what we think they want to hear. But what if you are being honest with yourself? When we have these honest conversations, we get more out of that. But more importantly, you are honest with yourself that way. And so, the more you operate from this fake self or your facade self, the further away you go from your true self, right? So you want to be who you are, because if you're not, you're just going to keep going farther away from who you really are. And then you have something that we call shadows. So you have this, but then you have something kind of in the background. It's like background noise that's happening. These are the underlying energies that are fueling your behavior. And for those of you who have ever listened to their work, Kathy Skipper, Florian Berkmeyer, and Dr. Bruce Burkowski, they do a lot of work in this area about the shadows, shadow work. And the goal of our psyche is to operate from our most authentic self, who we are and who we're meant to be, and not apologize or be embarrassed for that. So let's look at the theories of our two psyches, right? We have two governing forces that inspire our psyche, and that's the connection between our gut and our brain. How they communicate tells us how we drive action, right? How your gut and your brain works can dictate if you're reacting or if you're responding. And so our brain psyche, this is our neurocognitive psyche, our intellect, our cognitive functions. The bridge is our heart center, which is going to foster the healing and foster alignment. And then you have your gut psyche. So this is when we talk about head, heart, and gut alignment, head, heart, and gut health. You have to have this connection. 3 points make a straight line. So your 3 points of alignment are your brain, your heart, and your gut. And these are heavily influenced by gut health and by microbiome health. When your gut health is off, your microbiome health is off, you're not thinking straight, you're not rational, you have all these emotions and thoughts, you may get stuck. There's a lot that can happen that will affect you, that affects mental and emotional health. So when we add in aromatherapy, we add in scent therapy, the power that scent has at inspiring and influencing our psychological health. Scent is going to elevate our functions of our gut, our brain, and everything in between. It connects all of your being. It's going to motivate your behavior. It activates this connection or reconnection, because oftentimes it's going to happen. You're going to get disconnected. So let's just get you reconnected. You can't stay there. We've got to get you reconnected. And so we're doing that through the head, heart, and gut alignment, which is going to heighten your intuition so that you can be more comfortable in the decisions that you're making through your instinct and your intuition. And then it's going to balance all of the psyche, the conscious, the unconscious, and those shadow energies. So maybe you're like, oh my gosh, this girl, I don't even know what she's talking about. That's okay. Just do aromatherapy. It's going to help. It's going to help balance the mind and the body all at the same time, simultaneously. It's going to stimulate and invigorate your circulation pathways. When you're circulating and oxygen is moving and metabolism is going and everything's working in your body, and you have movement going on the inside, you're going to have movement of your mind and your thoughts, so they're not going to get stuck. It's when there's poor circulation, if you're stuck or you find yourself saying, I'm stuck, I'm thinking the same thoughts all the time, I'm feeling the same things all the time, I don't know, then you know your circulation pathways are clogged. They're not moving. And one way to do that is to smell some oils. Because when that pathway is working, you're going to absorb nutrients better. You're going to be able to take out the trash better and release those toxins. Physical, mental, emotional, energetic, spiritual, environmental, every toxin that could possibly be going on with you, they can come in, but they have to go out. They can't get stuck and they can't stay there. It's going to support, balance, restore, repair, and reinforce your biochemical communications, which is your neurotransmitters, your hormones, and your metabolism, right? We know when hormones are off, like you're a bear, things are coming out of your mouth that you have no control over. There's a lot that can happen. So we want to be able to balance these biochemical communications, these messengers in the body. It's going to strengthen and build processes and structures to improve your behavior. So what does this look like? Whenever we say psyche in action, what does this look like? It's your mindset. Do you have belief or do you have doubt? Is your mood balanced or is it explosive? Are you motivated, driven, determined, and have stamina? Are you just, I don't know, I don't care, I'm so unmotivated? Your emotions, do you internalize them or do you vent them? Do you scream them out or do you just swallow them in, repressing them? Your behavior, how do you behave physically, mentally, emotionally, energetically? Cognitive, let's do a check-in with cognition. What are you thinking? How do you decipher information? How do you make your decisions? How do you problem solve? Is it great? Hey, I'm right on it. Or man, it just takes me forever. I can't figure it out. I'm not connected to my gut. Or I'm making a decision because I feel responsible and dutiful to my facade self. I've got to do it to please everybody else, but it pulls you away from you and it doesn't feel right. How many times have you ever said, man, I should have listened to my gut? Yeah, you should. And there's ways we can be able to do that more through the power of using scent therapy, looking at your actions to respond versus react, and looking at your physical ailments, what's going on in your body, because those are smoke signals to tell you exactly where emotions are hidden. So some common emotional and psyche imbalances that you want to pay attention to. There's of course, a longer list than this, but the ones that I feel you really need to pay attention to, because this is your body screaming, indecision and uncertainty, feeling agitated, irritable, angry, aggressive behavior. You're feeling anxious and nervous, depressed and sad, confused, lost, scattered. I just can't think. I can't remember anything. Negative thinking, self-doubt or shame, unworthy, poor self-esteem, hyperactivity, can't focus, poor learning and execution functions, and repetitive unhealthy behaviors. So if these are constantly happening, we want to say, oh, okay, this can't continue to happen. We need to stop this. And so how can you help foster a balanced psyche? We want to look at the culprits behind the culprits. Oftentimes we just look at the culprits. Okay, well, that's just some symptoms, but we have to go back to the root causes. We have to look at the culprits behind the culprits to really find that point, that intersection of where things are stuck and causing us, internal turmoil, childhood traumas. Maybe we were conditioned as a child, you're not good enough. And we just have kept that up as part of who we think we are. We allow it to define us instead of redefining it. Post-traumatic stress and situational experiences, environmental and energy invasion, being around the electromagnetic frequencies and being around negative people and the environment that you bathe yourself in, that you allow yourself to be a part of. Dysautonomy and nervous system distress, sleep disturbances, circadian rhythm issues, GI issues, cardiovascular, oxidation, improper and inadequate breathing. Most people do not breathe properly. They're only breathing from their top two chambers, not all four. So if you open up your shoulders and palms out or put your hands behind your back, you can breathe. So oftentimes when you find yourself reactive or expressing an emotion or thought or behavior that's not healthy for you, then take a step back, take a good deep breath, and let's get some oxygen in. Spirituality disconnection. Malnutrition, allergies, inflammation, all go back to gut, genetics, and chemical and synthetic exposures. All of these contribute. And some of you have more than one of these that's going on. And so we do the best that we can to mitigate that and to balance that out, to give our psyche a good chance to stay healthy and be happy and content. So to do a scent realignment, what this is going to do for us is help us to unwind those healthy or unhealthy forces that are driving our behavior. We're going in this direction. We got to stop it and go back. And let's stop. It's just like if you're going down the wrong street and you put it in reverse and go back and so you can find the other road you're supposed to take. That's what scent can do. It can have you stop continuing a negative or unhealthy habit and take a step back, nourish, support, strengthen your processes and functions, and then help you create this personalized plan of action through the varying energies and direction of support. What direction do you need to go? What support do you need? It's not a cookie cutter approach, but you have to look at everything you're going through on an individual basis. So we have to go back and look at what it helps us to go back and look at what has history shown us, what has our ancient cultures done that we can learn from, so we don't have to reinvent the wheel. We can really take that and go, oh, okay, here's how we can, this is all we know now, let's make it better and create the space for our industry and holistic health to move forward. So if we look at our past influences and how they use scent to help psychological health. The Persians, they use scent for neurological issues and hyposmia, right? A decreased sense of smell. So anosmia and hyposmia isn't anything new. This has been going on forever. So if we're looking at retraining our sense of smell or heightening our sense of smell, this is where we need to add scent in. We do scent training. Greeks introduced the philosophy of the psychology of smelling, how smells can influence our psyche. Ayurvedic and TCM medicine, use scent to harmonize our psyche and vital energy, or chi, as they call it. And we have Dr. Jean Valnet, who used aromatics as an alternative to psychiatric meds. And it worked. So there's lots of history and efficacy. But moving forward, we have more science, we have more practice who have taken these ancient philosophies and theories and really turned them into our reality. Rachel Hertz, she's a neuroscientist. She does a lot of work with scent recovery, emotion, and cognitive responses. Marian Raven just got her dissertation recently this year on using aromatherapy for comfort, ease, and stress for adults with substance use disorder. We are seeing a huge increase in the amount of substance abuse because mental health issues are significantly on the rise. And so using aromatherapy to be able to help, that is going to be important. Dr. Burkowski's work in spiritual phytoessencing to really help the soul psyche. Florian Berkmeyer and Kathy Skipper with the shadow work. We're seeing this all happening now. Hospitals are integrating aromatherapy for pre and post-op and mental health support. So where can this go in the future? What can you do with it, or what are you going to be seeing in the future? And that's aromatherapy being an integral part of the healthcare system. It's going to be used. It's currently being used. We're going to see it more widely accepted and used as the therapy to help with opioid addictions, the opioid crisis and addictions that are going on. Aromatherapy is a nice alternative. Integrative scent therapy for mental and emotional support in our holistic and spas, but also medical centers. We're seeing a lot of hospitals and medical centers that are using scent to help their patients and help their clients. And we see virtual reality integration for psychobehavioral influence. So where they're matching scent to untrain, learn experiences to help with post-traumatic stress and to help overcome some of the unhealthy behaviors. So if we look at the neurocognitive role in psyche health, the brain and intellectual psyche, we need to look at the integrity of our pathways, our whole olfaction system, our gut-brain system, because the integrity is going to dictate if it's going to allow or disallow for psyche communication. If it's not healthy, there's not going to be great psyche communication, and then you're just not going to behave in a good way. You're going to be more reactive instead of responsive. It's the carrier of our energy and our messengers. It's going to give quality of our behavior. If you have cognitive impairment or dysfunction, you're going to have an altered psyche and behavior. So are you behaving in a healthy, responsive way or in an unhealthy and reactive way? And is this out of character for you? Some people may say, man, that's out of character. Or is it? People pleasing. This is a lot of people in our industry. This is it can be, a blessing and a curse at the same time. But really it's the facade to fulfill the perception of what we think other people want. We're just pleasing what we think they want versus staying true to ourselves. It's pulling you away from yourself, creating this friction, frustration, stuck, reactive. So if you or frustrated with a lot of things going on, even with yourself, and you just feel stuck and just, man, I'm just not the best version of myself, you need to stop and go, okay, what's happening? Because this is your body saying, hey, you keep going farther and farther away from your true self. I'm giving you some signals here. You need to come back home. You need to come back home to yourself. And then we look at nervous system communications or altered, fatigued, atrophied, inflamed. So the nervous system, which, everything communicates through the nervous system. And we have inaccurate and incomplete biochemical processes. This is where we have hormone imbalances, neurotransmitter imbalances, metabolism imbalances. So neurocognitive communications, we're going to look at the ability, how does our brain function, our neural pathways, the cortical networks. So how is the health? Are our cells working the way that they should? Our circuitry, is it saying the right messages and going at the right speed? Do we have the right communication system or is it miscommunicating? Is it sending the wrong message? Our nervous system is imperative here. So your central nervous system, just as a quick recap, is your brain and your spinal cord. Every thought, feeling, emotion, everything runs through the spinal cord. The spinal cord will deliver it somewhere. So when you repress something, it is going to go somewhere, wherever your spinal cord tells it to. And if it's stuck somewhere, then wherever it's not stuck, that's where it's going to go. Your peripheral nervous system, this is your whole body, your organs, your muscles, your glands. And within the peripheral nervous system, you have the somatic nervous system, which is your voluntary and conscious movements, but you also have the autonomic nervous system, your automatic, your involuntary actions, digestion, excretion, and heartbeat. This is why gut and heart health is so crucial because there's so many factors, everything we've been talking about that throws off our nervous system, particularly the autonomic. And so you're seeing a lot more research now, a lot more emphasis on dysautonomia. This is why. And with that, we're having poor digestion, poor excretion, either diarrhea or constipation, and heart health issues, blood pressure issues. You have an enteric nervous system. So when you were created, you had this nervous system, and then through the fetal development, you had your two nervous systems that split apart. You had the central nervous system and then your enteric nervous system. The enteric nervous system is your gut brain. And it's connected, your head and your gut brain are connected through the vagus nerve, which is your 12th cranial nerve. It allows for bidirectional communication. They can talk back and forth to each other, right? And this is what connects that enteric nervous system and the central nervous system. So when it's healthy, you can think, you can problem solve, you can manage your responses, you have better response time, rational thoughts. But when it's unhealthy, the inability and incapability to think, learn, remember, mood is imbalanced, decreased drive and motivation, irrational thoughts. So if you're recognizing some of this within you or somebody that you know, whether it's your family or a client, we really need to make sure in our custom blends that we're making, we have an oil in there that's going to work on balancing the nervous system, particularly strengthening the vagus nerve functions of keeping our nervous system in check and keeping it working. The neurocognitive biochemistry. We have to look here because this is what's going to help you choose the right essential oils, the right team for your blends to support and strengthen your functions and foster alignment. So with hormone messaging and delivery, so when we say biochemistry, your biochemical functions, hormones, neurotransmitters, metabolism. So let's look at hormone messaging and delivery, because when hormones are off, so is your mental state, your emotional state. And so we really have to come here and say, okay, if that's the case, and these behaviors are like really erratic and crazy, then I need to have a hormone balancing oil in this blend. And so we're going to look at two things. We're going to look at the imbalance. Is it excess or deficient? Deficient meaning it's imploding. You're internalizing, you're swallowing, lethargic, sad, you're just sinking in. Or is it explosive? Excess, you're externalizing it, this hot anger that's just spewing out. Because that's going to tell you the temperature. Is it cold or is it hot? So if you're deficient and pushing it in, it's cold. If it's spewing out in excess, it's hot. So then you're going to go to the opposite remedy to bring it into balance. So for somebody who's lethargic and sad, we need to have some heating oils, stimulate to bring it back into balance. So how far you are in one direction or the other is going to dictate how much of the heating oils you're going to put into a blend. So cinnamon, oregano, and thyme are great examples. If you're explosive and hot, then we have to bring in some cooling remedies such as lemon, chamomile, mints, and ylang ylang. With metabolism, how is your metabolic speed? How is your energy? How is your accuracy? So scents can foster this movement and decrease sluggishness. So when I say metabolism, a lot of people think instantly weight loss. Okay, well, that's fine. I say weight release because you can lose things you find. So I say weight release instead of weight loss. But weight is not always physical. It can be emotional and mental. And so with metabolism, if your metabolism is off, the way you metabolize your thoughts, your feelings, and emotions are also off. Keep that in mind. Oftentimes we assess physically what's going on and we don't do it until we're in pain. There's an emotional counterpart to that also was screaming. And so it didn't just come out of nowhere. Maybe you just recognized it. So I'm bringing this to your awareness that how you metabolize your emotions or thoughts. My 4 favorite oils, of course, there's more, but my 4 favorite are lemon, rosemary, cedar, and vetiver to really work on balancing the metabolism. Your neurotransmitters, this is what's sending and receiving messages and regulating your entire nervous system. It's heavily dependent upon your gut health. If your gut is not healthy, nothing else is. So your neurotransmitter support, I just want to talk to you about 4 in particular. These are the 4 most common areas of imbalance that I see. Dopamine. So this is your pleasure and reward, feeling accomplished. It's going to boost your confidence and motivation. Now, if you have low self-esteem, I'm not good enough, I can't do that, you're always down on yourself, you don't feel valued or self-worth, then we need to give you a dopamine boost. And we can do that aromatically by adding in some citrus, such as lime. Lime is a great adaptogen oil. All of your oils are adaptogens, but there's some that are way more adaptogenic than others, and lime is one of them. Helps you adapt to whatever's going on. Camphor quality oils, eucalyptus and mint, right? To give you room to breathe and just, yeah, I can be creative and I have the space to be me. Euphoric oils like clary sage and your root oils like ginger and turmeric. So doing a combination of these, right? You don't have to do all of them. You can pick one or you could do a combination of these to do a dopamine boost. Serotonin. So this is your happy juice, right? It gives us this motivation. It helps to combat feeling depression and sad and despair. So we want to add in those adaptogens and antidepressants. This is going to be your flower oils. And some of my favorite flower oils are going to be geranium, jasmine, palmarosa, the petitgrain, neroli, and your fruits like yuzu. Now, yuzu is an adaptogenic oil, just like lime. And so if you need a really powerful adaptogenic blend, lime and yuzu, I love to put together, and I like to put spearmint with it. That's kind of my trio for that. There's research that showed bergamot and lavender inhalation of these scents were shown to help balance serotonin levels. I think it's great that we're starting to see science with our neurotransmitters. Acetylcholine is closely related to cognitive functions, memory. So as somebody is progressing in a dementia or cognitive deficit, you'll see acetylcholine being imbalanced and decreasing. So to boost that and give a mindset boost and focus and thoughts, these are my three favorite memory, mood, brain, cognition boosting oils: lavender, frankincense, and rosemary. And then GABA is a relaxant for the nervous system. So oftentimes we get so stressed and we need something just to relax us, calm us down, calm the anxiety, help us sleep better, calm those reactions and turn them into responses. And so chamomile, lavender, patchouli, and vetiver are four of my favorite here. There are more, but these are my top four. With the gut brain and HPA axis and the microbiome connection. So that's a mouthful, but just know your gut brain has this connection, and your HPA, your hypothalamus pituitary adrenal axis, is what gives you the energy and ability for the communication to happen. And in order for that to happen, the microbiome has to be healthy. So, of course, psyche balance requires gut and microbiome health. This axis is the intermedium that's balancing that equilibrium between neurocognition and gut psyche. So your intellect and your instinct meeting in the middle with your heart center, leading with your heart, but having the intellect to back you up and the intuition to back you up. So with your nervous system, this runs to and through the gut. And you're going to see this when we start talking about smelling the different scents, is responses. How do you respond? You respond one of three ways. And oftentimes we think of fight, flight, or freeze. But think of it this way. You're either being defensive, you're pushing back. No, 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 this is unfamiliar. I'm uncomfortable. No. You go into protective mode where you're squeezing it, controlling it, holding on to it. Or you can go into surrender, and surrender could be good or bad, right? I use the word release, submitting or putting your heart wall down, putting your defenses down, and allowing the ability to receive, to give, and to receive, because this is where that HPA balance can happen. You have imbalances and deficiencies are going to cause distress and miscommunication, messaging interference. So those hormones, neurotransmitters, metabolism are highly affected by the energy and vibrational energy that are around you, right? So we look at, any interference from electromagnetic frequencies, just being around negative people. Some people say, I'm not mad. You might not, they may say they're not mad, but you feel it. Right. So this is what I'm talking about. Short circuitry. So when there's an electrolyte balance, the kidneys are not functioning as well, the liver's not functioning, the gut's not functioning, that's going to lead to irrational thoughts. And then this is where we have psyche imbalance. Now, there was a study that I found that shows citrus sinensis, which is your sweet orange, was shown to help with HPA axis restoration because of its limonene content. There's a lot of oils with a higher limonene, but they tested the sweet orange. So I'm not surprised that sweet orange came up with limonene because this is an adrenal oil. So is pine, so is vetiver, Tanacetum annuum. All of these are really going to help support and strengthen our adrenals, which is going to give us the energy to work on all of these other things that we're talking about. So how scent influences your behavior? It's going to help you respond, which is going to give you this proactive based experience, skills, and tools, right? So we're being proactive about something versus being reactive, unfamiliar, emotional triggers, this inner defensive wall. We put up this wall because we feel this invasion. And so we just, go into reactive mode. Behavior. So actions and habits based on your responses and your reactions, your attitude, your approach to how You handle something, the approach we take, which is behind the action. What is driving that action? Because actions are fueled by courage or fear. And now we're starting to see how scent can really play a crucial part in behavior modification. You can convert fear, you can reprogram fear into courage and feel good about it. It's going to help with impulses, whether you're fight, flight, or freeze, your survival instinct, because this is what's driving your biochemical system. Instinct, your intuition's shining through when you're aligned, or are you ignoring it? Are you saying, no, I'm not going to listen to my instinct? Don't do that. You got to listen. And nervous system, that's determining the quality of these actions. And so you're seeing where dysautonomia, that autonomic nervous system, when it's imbalanced, it's going to disconnect you from your instinct and your intuition. So if you don't feel connected, we have to go back and look at, the autonomic nervous system, I really need to strengthen that. I also need to strengthen my HPA axis to really get everything communicating better. So we want to look at the limbic system and the role that it plays, because it can lend this tremendous support and strength, your limbic system, how we smell, how we perceive a scent, what we can do with that, and how it's going to shift and inspire and influence your behavior. So we look at the olfactory bulb. When a scent comes in, it's going to the olfactory bulb for this coding, right? What is it? Now, if you have hyposmia or you have anosmia, lack of scent, low scent, inability to smell, you're going to lose connection. So everything else I'm about to tell you is not going to work right. And you're going to stay stuck in everywhere else. You have to get smell working good. That way you can stay connected. We also know, and it's been proven through some scientific studies that were repeated a couple times, that the way viruses get into the body is through your olfactory bulb. That's your portal of how viruses get into the body, things that are affecting us. So using scent to strengthen that olfactory bulb is also going to strengthen your immune system, which is going to strengthen gut health, which is going to strengthen your whole psychological health. Your olfactory cortex, this is where you detect and identify a scent, and that's where it's going to influence your behavior. Your hypothalamus, this is your action instigator, your stimulator, your metabolic regulator, how messaging is occurring, right? Any deficits in the hypothalamus, messaging system is going to be a little wonky. With your thalamus, this is your sensory and perception and motor function regulation. Now, these bottom four are they're all about neurocognition and how they affect behavior. Your hippocampus, we know so much extensive research about memory, conversion, space, and time awareness. For somebody who is going into dementia, or we know that they're going into a dementia state or cognitive deficits, is because their hippocampus starts to shrink. It starts getting fuzzy all around, and it's starting to shrink and not be there, right? When it starts disappearing, your memory starts disappearing. You have no concept of time or space. You think it's been 2 hours and it's been 2 minutes. Your fornix is what connects your hypothalamus and your thalamus together. So when you start seeing memory going and sensory and motor function starting to go, it's because the fornix is just like, there's nothing there for me to even tap into to connect. This is where memory happens, and episodic memories are those autobiographical memories where we recognize things. And that's why with dementias, we see, okay, they can remember stuff from the past, but can't remember things right now. This is why. And when this starts shifting, or if this is compromised, it's going to contribute to that emotional and social behavior. How do you handle things? Because the amygdala, next up, is your fear center. This is where somebody gets really stuck with PTSD. And this is a situation, if you go through a traumatic situation, it can really affect a physical structure. But if you have physical structure damage to your amygdala, it can cause more heightened fear on a psychological level. So this is where they go hand in hand. They work in tandem. And so with the amygdala, you have memory storage, your decision making, your fear, aggression center, your instincts, your survival instincts all happen here. And the amygdala, we know the fear center. We also know you hold fear in the kidneys. One of my number one oils for fear is frankincense. Frankincense, you lead in faith, not fear. And that's a good way to remember it. Your basal ganglia, this is where repetitive behaviors happen. And now you can see hippocampus starts decreasing, the fornix is compromised, the amygdala starts being compromised, and now the basal ganglia. We're having this repetitive behavior. We're having, conditioning happen over and over and over, behavior changes, memory changes, blood sugar is out of balance. So it's not a surprise that dementia is called type 3 diabetes. So we're seeing this huge connection. Scent starts to decrease as our cognitive functions decrease, as the neurocognitive faculties are not working, scent starts to decrease. So we have to keep it's like a muscle. You have to keep using it and triggering it through sense of smell to get it working. So looking at scent shifting influence, this is going to guide you on your journey to uncover and discover hidden and buried emotions. So we've talked about why we work the way we do. Now we're going to talk about where we go from here. What are some things we can put into play, into action to help us? So we're going to use scent to shift our psyche. And this is our journey, right? We're finding what we like, what we don't is going to tell us what we're ready to work on and what we're not, what's buried. It's going to help you find, identify, acknowledge, understand, release, and honor those things that are hidden. And then it's going to shift that unhealthy energy vibration into alignment to strengthen your inner biochemical communication that's been molded from your past physical, psychological, and biochemical experiences. And what we're going for, the effects, we need positive reinforcement and thought for belief conversion. We want our cells, tissues, and organs, they believe everything you think, feel, and say. So you need to tell it something good. You need to feel good. We want to turn anger into contentment, heat reducing. So we're going to use hepatoprotective oils. And those could be helichrysum is one of my favorite. Turmeric is another. Frankincense is another. Fear and surrender, returning that to courage and willpower, stimulating nephroprotective, kidney protective oils like pine, juniper, geranium. For despair, we want to turn that into understanding. We don't have to give up despair. We just need to understand it and lead with a compassionate understanding, nurturing lung supportive oils. We want to turn worry into confidence. You hold worry in your gut. So let's be more confident with flower and spice oils or gastroprotective oils. You want to turn abandonment into feeling worthy. We're going to do that through nourishing and neuroprotective oils. So I'm going to share with you a strategy, a psyche balancing aromatherapy strategy. It's my 3-step approach. First, we're going to do olfactory sensory testing. So you grab your oils, you're going to be smelling the oils, and we're looking on a scale of 1 to 10, 10 being, oh my gosh, I love it, and 1 being, no way. Where does that fall in our scent preferences? Do we like it? Do we not like it? And this is also going to help with olfaction strengthening, right? It's going to strengthen. Remember that targeting, we need to, our sense of smell is a muscle and we have to keep it in practice. So we're going to do olfaction strengthening because that cilia and neurons, they reproduce every 30 days. And so you can retrain and strengthen your sense of smell. It's going to allow your scent pathways to be rejuvenated. This is why retraining and olfaction strengthening is so important. The smell is really going to help deepen your connection with yourself. It's deepening your connection to who you are, where you are, what you want. And then you're going to be able to interpret those scent responses through scent interpretation. So we have scent-elect where we understand scent, we have scent-tuition, right? We have this intuition about it, but being able to interpret what they really mean is going to tell you more about yourself and more about your client, maybe than you wanted to know. We're also going to do terrain assessment. And so we're looking at the terrain, the biological terrain. Is it hot? Is it dry? Is it wet? Is it cold? Is it tense or is it atrophied? And then we're going to do a custom blend formulation. In that blend, the key is to meet you where you are, where you've been, and where you need to go all in one in order to bring everything into alignment. So let's do sensory testing. Grab an oil if you have it, and then we're going to smell it. Right? So smell it, but I don't want you just to smell it. I want you to feel it. Where do you feel it in your body? And let that scent tell a story, unfolding layer by layer. Your responses tell you if you're open to work on something or not. It's going to activate your memory. How deep and painful is that buried emotion? Your response is going to let you know that. It can guide you to the exact organ of where it's hidden, and it's going to tell you where that hidden gem, it's going to put it on notice to say, hey, I know you're there. I'm going to try to get you out of hiding. It might not be in this blend, but it's coming. And then, you're going to know, are you or the person you're working with open to connect, acknowledge, and release that? And if you're doing this virtually where they can't smell or you're not with them to do that, then you're going to have to pull in your scent-elect, your knowledge about the oils, your connection to the oils, and your intuition. You can bring in muscle testing to help you after you do a proper intake, of course. For the terrain assessment, what you're going to do with this is you're going to know how much is needed and in what direction for the balance. So you're going to use this when it comes to the formulation process. If something's dry, how dry? If something is wet, how wet? Do you need a mucolytic, or do you need a decongestant, and how much do you need? Because if we just have to bring you into balance a little bit, you just need a little bit. But if you're like way out, then yeah, we might need to have more of that particular oil. The degree, how excess or deficient is it? We're going to look at the temperatures, the pairing of the hot and cold remedies. So with your metabolism and circulation, this is your energy production, your heat and coldness of your psyche. Do you have heated emotions or cold emotions? And your hidden emotion organs are going to be in your immune, your liver, your nervous system, and your glandular system. The action. So is it tense or is it atrophied? So you're going to need some astringents and some relaxants here. And your hidden organs are going to be the skin, the muscles, and the bones. And then your saturation, is it wet or is it dry? Do you need mucolytics or drying? And how much of those do you need to facilitate gut health and allow you to absorb and to hydrate your tissues? And so here, this is going to be affected in the lungs, the blood, the lymph, the urinary, all your fluid systems. So now we're ready to do the custom blend formulation. So your scent preferences, this is going to tell a story. And your scent preferences, we need to assess the degree and direction that's needed, because that's going to tell us which ones are going to go in the blend and how much of it do you need in a blend. You're going to customize the percentage and the volume. You're going to look at your goal, the goal of this blend, to activate, stimulate, support, and strengthen all at the same time. And then we're going to choose the scent categories. Which oils are we going to choose by category? Or are we just going to go in and just, grab a bunch of different oils and freestyle it? Or are we just doing the scent preferences that you liked or that the client liked? Because this is going to activate and stimulate those surface emotions. That's what we're going after. Because if we can clear out those surface emotions, every layer you unfold, you can go deeper. And this is where we want to go back to self and really go deep and start balancing to get back into alignment. Your subset profiles, that's going to be your euphoric, balsamic, earthy, mint, licorice, and your roots. These are going to drive more inward, right? The inward emotions for strengthening and release. And your therapeutic properties is going to help you with the direction of support. Remember, you're not always working on what's broken. or what's not right. You also want to strengthen what's already strong to keep it strong. So we're going to look at scent interpretation and what this means of scent preferences. So with your essential oil team, you're going to look at the likes, the dislikes, the neutrals. You're going to look at the strategy here of how essential oils fit into the process and the goal, because you want to understand these scents. You want to connect with them on a very intimate level. So you know them like a person, you know their personality, how they can mold and modulate behavior to bring balance, using scent to activate and drive the story. So when you smell something, or you have a client smell something, you can use that to navigate the story, right? Through their responses. Oh man, that reminds me of something. Okay, well, tell me more about that. Or they start telling you something and that leads you to an oil. You can do it either way, but you're looking for this to unfold those layers and allow the story to start telling itself. So it basically is a narrating tool. Interpreting your scent messages. What does it mean? Discovering the hidden gems, because you want to release those triggers and that trauma and reprogram and restore your authentic connection. So here's what it means. When you like something, that means you give it a 7 to a 10. On a scale of 1 to 10, that's like a 10. Oh my gosh, yes, please bathe me in that. A 7 is like, yeah, it's good, And so ready, willing, and able to work on those surface layers. Your top 1 to 3 layers is non-threatening, so you don't have a defensive wall up. When you go to the neutrals, that's the ones you give a 5 or 6 to. And this is kind of in between. It doesn't really create strong movement either way. You can take it or leave it. You're kind of like, just, yeah, I mean, I'm here. And then your dislikes, you give it a 4 to a 0. And that means, no way, I'm out of here. Take it away. Don't ever let me smell it again. That's because it tapped and it touched your deep inner layers and those hidden gems. It really hit a nerve. It hit that heart wall to say, okay, I'm not ready. I'm putting up the resistance. I'm putting up the defense. I'm putting up my protective wall here. So I'm going to walk you through when I'm going to interpret your reactions, your responses, your scent responses to a few oils. Lemon. So the lemon essential oil personality, this is going to light you up. It's lighting up your path. It allows you to tap into your fun side and stay there. It's like a flashlight. It shines a light on your path so you can see where you're going. It's also going to help neutralize invaders that way. A powerful immune oil. When you give it a 10, you're like, yeah, the path is lit up. I'm excited. I'm ready to go for it. I'm ready. A 5 means, you can see what needs to be uncovered, but looking with one eye open and one eye closed. You're like, no, I can see it. I don't know yet. I'm just going to stay right here. I can see it though. And a 1 means you're not ready to see it or move on the path. And you find this a lot in addictive habits or addictive relationships, is that they just don't even want to see it. They want to stay where they are. They're stuck. They're frozen. So this would be, if you're in that freeze mode, this would be a very good oil to help. Neurocognitive wise, it's going to open those pathways and give you a clear mind, also clear vision to see and clear hearing to hear the messages coming to you, to create movement, helping you defend against invaders. Geranium, this is a flower oil. It's bringing you harmony and balance to keep you from teetering between two opposites. Geranium also is very gentle. So you think geranium, gentle, yet firm, balancer. It's going to give you a hug. It's going to be very compassionate with you, but it's not going to let you stay where you are, right? It keeps this soft side of you strong so you can set healthy boundaries, which is going to help you neutralize some stress, right? Because whenever you're too stressed and you're not setting a boundary, it just kind of puts you in overwhelm. So a 10 means that you're ready to lead with willpower and courage. You have self-love, self-worth. A 5 means you don't want to give up, but you feel like you may have to surrender. You're wishy-washy. You're kind of in this in between. And a 1, you just want to surrender. You give up, you're disappearing, you feel defeated. Yep. Throwing in the towel. So geranium, even though you don't want to give up, If you give it a 1, don't push the issue. It'll come. You wait for yourself or the person you're working with to be ready. You can't force it. Don't force it. A neurocognitive support, nervous system and circadian rhythm modulator. For gut support, nervous system, your gut, your depression, your SAD. It's a mucolytic, so it's going to hydrate rigidness. It's also an astringent to help tighten and tone, so you set those healthy boundaries. With cinnamon, a spice oil, this is going to ignite your fire. Most cinnamon or most spices are going to ignite your fire, your passion, your desire with joy. Cinnamon in particular is like giving yourself a big hug, right? So you can work through, feeling defeated, your self-doubt. You can own your worth. You can get out of your comfort zone and you feel safe, secure, comforted. So when you give it a 10, you do feel safe. You're ready to connect with that inner passion and drive. You're ready to feel joy. You're willing to accept it. A 5 means you're able to attain your dreams. You just don't believe in yourself yet. And a 1 means I can't even see or feel my self-worth. Victory is unattainable. I'm just frozen. I can't even imagine. And that's a key word you want to listen for. With the neurocognition, your HPA axis modulator, your cinnamon can really bring balance there. That's why it's also an adrenal oil for Psyche, for hypothalamus, pituitary, adrenal. It's going to nurture the heart center. It's going to help neutralize invaders that are eating away at you physically, mentally, and emotionally. With marjoram, this is in the herb family. So herbs are going to be nurturing your abilities and capabilities. I can do anything when I'm nourished. Marjoram particularly helps to numb the pain so you can move through it. Some things are just too painful. And so marjoram is a very good nervine to help with the pain, to help you find joy and opportunities and possibilities. A 10 means you're ready to connect to the pain, the memory, the situation, and release it. And you believe that you deserve joy. 5 means you know your worth, but you have self-doubt in your value. And a 1 means don't believe, that you deserve joy at all. Like, no, you're not ready to face the pain and you're just stewing over it. And again, don't force it. Let it come in time. Just make a note that have yourself or have the person you're working with smell it next time, because what we're looking for, the progress we're looking for, is they make friends with marjoram, and eventually that 1 becomes a 5 and then maybe a 9 or a 10. The neurocognitive support, it's going to help slow down hyperactivity, rapid thoughts, and emotional chatter. It's antispasmodic. So think of not only, cramping, but also anxiety, a spasming of the nerve, so you can move forward. Peppermint. So your mint, this channels your inner extrovert to take action with enthusiasm, to try something new. Peppermint, allows you to take in new ideas. It's going to quiet apprehension and fuel that inner adventurer in you. A 10 means you're open-minded, you're ready to learn something new, and yes, let's do it. Let's go explore. A 5, you could learn something new or engage in a new experience, but you lack motivation. And 1 means that you're closed off, you're hidden from that, not ready to see it from a different perspective or speak up for yourself yet. In neurocognitive support, it's going to help with mental exhaustion and burnout. Gastrologically, it's going to help cool the cramping, heated emotions and thoughts. Gastroprotective. Peppermint is very gastroprotective. We have a lot of research studies showing the efficacy of that. And pine for our trees. This is going to connect to your inner strength, your soul roots, to keep you stable, rooted, grounded. Pine is known for its resilience through upheaval whenever you feel burned or betrayed by somebody. So this is a very powerful oil. When you give it a 10, an 8, 9, or 10, you're open, you're ready to release the blame, the guilt, and betrayal. But if you give it a 5, you know that you have to, but not sure if you're able or capable or even can endure it. And a 1, you're just like, I'm so deeply hurt. I feel so deeply betrayed and burned, and I'm just not ready to face it. Or you feel very burned out. It's going to help with the nervous system and glandular system support. And a very key thing here is it's going to balance your parasympathetic and your sympathetic nervous system, calming the burning sensation, reflex irritation, but also irritation, frustration, anger, aggression. It can calm those emotions down. So your blend overview, you're going to assess the preferences. Where is it on a scale of 1 to 10? Right? You want to do a good intake. You're going to pay attention to your scent-elect. So in your oil choices, you want to look at the benefits and the safety to make sure you understand its role within a blend. You have to apply the intensity because maybe you like lemongrass in a blend, but I tell you, if you put too much lemongrass in a blend, it's going to overtake that blend. So you have to bring in your knowledge and your training here to say, okay, even though they gave lemongrass a 10, I'm still not going to put the most in there. I've got to bring it down a little bit because it can overtake a blend. I just need it to do its job in the blend here. Your scent experience, but also the client's scent experience. If they're very new, you're not going to go in with a high dilution ratio. You're going to do a low dilution ratio until they build up a relationship with the oils, because the oils will never let you lie to yourself. And if you go in with too much, it's like going in with the bulldozer. You'll throw them way off balance and they might not come back. So with knowledge comes responsibility. And so we work up to a higher dilution ratio. So maybe start with, a 1% or less, and then you could work up from there. Creating an essential oil team, additional support to shift and reinforce the energy. You could always add in flower essences, gemstones, label blessings if you'd like. So I wanted to give you an example here of olfactory sensory testing results. So this is for stress relief. So over here, you can see the oils that my client smelled. And then on a scale of 1 to 10, where did they rank that? So lemon was their 10. So I'm definitely putting lemon in the blend. Grapefruit and geranium was a 9. So was peppermint. So that's in the blend. Helichrysum, marjoram, and eucalyptus, they gave an 8 to. So I'm going to put that in a blend. Now, you could just do your 8, 9, or 10s, and you could follow the 3, 2, 1 blending rule, right? So 3 drops of your 10s, 2 drops of your 9s, and 1 drop of your 8s. But I also want to add in the 7, the 6, and the 7. So I'm going to add in just a little bit of lavender and pine and just 1 drop of cinnamon, because everybody needs a hug. And I know they gave it a 6, which I don't normally put in there, but because it was cinnamon, I just feel this person needed a hug. So I put it in the blend. And here you can see their ranking. I put them in order. And the scent interpretation to that is lemon allows the light to shine on the path so you can see where you're going, taking the blinders off, finding your voice. The grapefruit in this blend is going to help the person be ready to move and get unstuck or release those bitter emotions. The lavender being a 7, I just had a little bit in here. And so that's going to bring in some balancing and harmony to their inner beauty so they can connect with their inner beauty. A geranium in here, balance to connect to self-love and willpower. They didn't like the helichrysum, so I'm not going to put it in here. But if they liked it, I would tell me they're ready to work on deep emotional wounds. But because they gave it a 2, I know they're not ready. Cinnamon, they're almost ready. A 6 means they're almost ready for a hug, to feel safe and secure and to come out. So by putting 1 drop in here, I'm just doing a shoulder hug. I'm putting 1 hand on their shoulder and say, okay, I'm not doing the bear hug, but maybe we'll get there. Clove and oregano both were a 4, and those are anti-parasitic. So it leads me to believe maybe this person is in a parasitic relationship and they're just not ready to make any decisions there. But clove particularly, negative thoughts, cold emotions need warming up first. They just can't even connect yet. Oregano, they feel beaten down and attacked and no support system. For marjoram, they gave it an 8. So they're accepting, hey, I'll numb the pain so I can have some joy here. I'll do that. Peppermint being a 9, yeah, I'll tap into my fun extroverted side. I'm okay with that. Eucalyptus was an 8, so they're ready to reduce some overwhelm and congestion and have room to breathe. Pine was a 7, so I'll put a little bit in there to help with resilience. Give them some resilience to cool the burn, nurture the adrenals and the nervous system. And myrrh, I won't put in because they're not ready. So that tells me they're not ready to speak up for themselves. They're feeling muted or silenced, and they're just not ready to do anything about it yet. And this is the blend. This is how the blend turned out. The custom blend, we did a 4-ounce massage oil. We did about a 1.5 dilution ratio. And so I kind of worked out the numbers for you. In this one, I blended by the drop instead of doing a more clinical approach. I did more of my freestyle approach because I just felt it needed to be a natural nature connecting blend. And in nature, nothing is perfect. So I did 6 drops of lemon, 5 drops each of grapefruit, geranium, peppermint, 4 drops of eucalyptus and marjoram, 3 drops lavender and pine, and just the 1 drop of cinnamon. Because I just wanted to add a little bit in there. And so again, I worked out the numbers so you can see we did 1.5% dilution of essential oil to 98.5% of a carrier oil. So where do you apply it? The massage oil. Well, the adrenals, this person had a lot of adrenal issues, so I'm going to have them apply it over the adrenals, but also on the reflexology points. If you have liver stuff going on, you'll put it over the liver. You can also put it on your pulse points as well. How often? My rule of thumb is 3 times a day, and anytime you're thinking about it in the day or anytime you need it. I also look at matching it up with the circadian rhythm. So for people having kidney issues or urinary issues, we know circadian time is between 3 and 5 is the bladder, between 5 and 7 p.m. is the kidneys, right? And so if they're having kidney stuff, then I'll have them use it during that time zone. If it's while they're sleeping in the middle of the night, then I have them do it before bed. And then they want to refill or reformulate. You want to reformulate when that scent response changes because they're going to go, oh my gosh, I love the blend, and they're using it. It's going to come a point when they're like, it doesn't really smell the same or do the same thing for me. And so you can make the changes then. That was a lot of information, but I got so excited because it's so powerful when you can balance your mind. You can nourish and feed your mind so that you feel psychologically balanced. You feel like you can handle whatever is thrown your way. Not that you're asking for it, but you feel that you can handle that. And so that is just so important. So I want to thank you for your time and just really, being committed to yourself for being here. Because I know that's something we deprive ourselves of too much. And as a thank you, if you want to learn more, I have a free mini class